Has someone ever spoken to you in a way that made you question your own experiences or even your sanity? When I was about 11, I had severe asthma to the point that sometimes I stopped breathing entirely. My mother found a specialist out of town. I remember sitting across from him, describing what I had experienced. I was young, vulnerable, and afraid that if these severe asthma attacks kept happening, I wouldn't survive them. I'd never met this man before, but he was a doctor and I was desperate, so I looked to him for help. He listened to my experience, then turned to my mother and said that what I described perfectly matched the symptoms of a severe asthma attack. But I was either a liar or mentally unstable because it wasn't possible for me to have experienced that and still be alive. My world was turned upside down. Doctors were adults who were supposed to be trustworthy. They're the people you turn to when your life is in danger. They're supposed to know everything, or so I thought. And here was this doctor, this authority figure, telling me that I was either crazy or a liar. Well, I knew I wasn't a liar, but how could I tell whether or not I was crazy? Even though I knew what I had experienced was real, and even though there had been witnesses, in that moment, a seed was planted that has proven very difficult to root out. I'm supremely grateful for how my mother responded. She told him in no uncertain terms that I was neither insane nor a liar, and we never went back to him. We found another doctor who confirmed the diagnosis of severe asthma and started a treatment plan. But damage had still been done. I remember wondering, if a person is hallucinating, are they able to tell whether or not they're hallucinating? Or what if you're in a coma and dreaming? How can you tell it's just a dream? How can you know whether what you're experiencing is actually real? This experience left me with some baggage that would re-emerge later when my foot was crippled. In January 2019, I went to a podiatrist because I wanted arch supports. He told me that I needed surgery instead, and that I would have crippling arthritis if I didn't. I believed him. Here again, I think that culturally, we're conditioned to trust doctors because of their esoteric knowledge and experience. And the vast majority of the time, my doctors have given me valuable guidance and assistance. Now that I'm a little more experienced as a patient, I've seen that sometimes there are exceptions. Now I picture a bell curve where most doctors have average competency. A few are truly superb, and unfortunately, a few are the exact opposite. Back before amputation, I was still fairly naive. I blindly trusted that first doctor when he proposed surgery. I didn't question his assertions or seek second opinions. And I trusted him again after the surgery when he told me something that I knew simply wasn't true. You see, after my surgery, my foot didn't follow the game plan. When I got off crutches, I tried to walk, but my foot just wouldn't work right. It was extremely painful. Long after I should have been returning to normal, I was still in a boot and using a cane. Every step produced a sharp pain that never went away until the day my foot was amputated. Confused by my lack of progress, I asked the doctor what was going on.
Some patients have different pain tolerances than others. Push through the pain.
If you've seen this video, you know that he also explicitly told me to go back to Taekwondo. His exact words were, "Go kick things." Now, deep down, I knew that this was a terrible idea, and I also knew that I have a high pain tolerance. In fact, a month before surgery, I'd given birth without pain medications, even though I had a torn abdominal muscle and had been induced with Pitocin, both of which definitely added to the pain. Far from having a low pain tolerance, my shortcoming is that I sometimes push through pain when I shouldn't, which is exactly what happened. Trusting the doctor's word over my own, I did exactly what he said and went back to Taekwondo, cane and all. Since my foot didn't want to support my weight, I stood on my good foot and kicked the back with the foot that had been operated on. Each kick was exquisitely painful, but the doctor had said that I was being wimpy and this was the way to get my foot better, so I kept kicking. I listened to the doctor instead of my own body. I did this for 2 months, after which the doctor informed me that I was perfectly fine, and then he walked away. Not even giving me a chance to ask questions or inform him that I was far from fine and really needed help. I had no choice but to find a new doctor, which actually turned out to be a good thing because I found a truly excellent doctor. He did some imaging and discovered that I had an unincorporated bone graft. There was a gap between my bones with nothing in between because the bone graft put in by the original surgeon had deteriorated to the point that was literally sludge. If you think walking on a fractured foot hurts, imagine walking on a foot where there's a chunk of bone missing. Then imagine kicking things with it. That's when I realized that for the second time, I'd fallen for medical gaslighting. Now, I can't tell you whether either of these doctors intended to make me doubt myself, but I can tell you that their words did make me doubt my own experiences and even my sanity. My childhood experience left me with a strong compulsion to find evidence that proved what was actually real. For example, whenever I worked out pre-amputation, I would wear a heart rate monitor because I didn't truly trust my own perceptions to tell me whether or not I was working hard. I wanted to see numbers because numbers aren't subjective. All those numbers were recorded faithfully in spreadsheet after spreadsheet so that I could spot trends and identify highs, lows, and personal averages. Whenever I broke a bone, I needed to see an x-ray before I could accept that I was actually injured. That mindset of cross-checking, documenting, and verifying became habitual, except when listening to medical professionals. I just never questioned them. The irony is that my second gaslighting experience helped me recognize baggage from the first experience. I started looking at the coping mechanisms I'd developed and with the help of a counselor, figured out which ones were unhealthy. It isn't healthy for me to blindly trust someone else, even a doctor, to the point that I discount what I'm actually experiencing. Cross-checking and documenting data is actually very useful and is part of my personality, but it isn't so good if it turns into a compulsion. I needed to tone it down and make sure I was doing these behaviors for healthy reasons, such as tracking goals, rather than because I was doubting my own sanity. I'm not perfect, but I've made progress. I no longer feel compulsion to wear a heart rate monitor when I exercise. I just get out there and do my thing. Now that I've identified what I was struggling with and have been working on it, I'm pleased to report that because of my efforts, I was recently able to avoid making a similar mistake. Back in December, I hurt my shoulder. I don't even have a good story. I was just puttering around the house and somehow strained my right shoulder. At first, I struggled to believe that it was truly injured and not just sore. But then I remembered how that mindset had worked out for me in the past. So I went to my primary care doc and physical therapist and got some imaging done. I felt so relieved when the MRI showed that I was really injured because that meant it wasn't all in my head. Technically, it was in my arm. But why should that even be a question? If I couldn't use my arm, it should have been obvious to me that I was injured. Clearly, I still have a long way to go in overcoming this. Past gaslighting made it extremely difficult for me to accept that I was injured until I had this objective proof, which is a little pathetic. When I realized that I was falling into the old mindset, I started watching myself to make sure I didn't fall for the same thing again. I was told not to use my arm for a couple weeks. Naturally, I made a video about it because I was feeling a little discouraged. The day after Christmas, I wrenched my arm. I can't pinpoint the exact moment I injured it. I was just doing things around the house and taking care of my kids. Then my arm started hurting, and then it didn't want to move normally. Raising or extending my right arm is a no-go, and yes, I'm right-handed. I know that my arm shouldn't take long to heal. 2 weeks is not forever, except my shoulder never did heal. Months have passed, and it's still grumpy. Not as bad as it was, but still far from a full recovery. I frequently find myself planting my elbow to my side, so I'm only moving my lower arm rather than my bicep and shoulder. I've also been doing more and more things left-handed. All that practice from breaking hands in the past has come in useful. Anyhow, I went to a couple different doctors. Not my usual doctors. You see, my usual docs tend to specialize in legs, not arms. These new doctors said that the MRI showed a tear and I needed surgery. Thankfully, this time I remembered the past. Having lost a leg because of a surgery gone wrong, I now have a rule that before consenting to surgery, I need multiple opinions, preferably from top-tier specialists. I found 2 out-of-town doctors, one who specializes in shoulders, the other specializes in soft tissue injuries. Both doctors came to the same conclusion and the same diagnosis. They both felt that the original MRI had been misread and that I didn't have a tear, though my arm is injured and will probably take a while to get better. Further imaging supports their diagnosis. If I'd just gone along with the first opinion, I would have undergone a surgery to fix a tear that didn't even exist. Worse, since I have a history of complex regional pain syndrome, which can be triggered by surgery, I could have ended up with CRPS in my right arm. I lost my leg because I consented to a surgery that, in hindsight, I doubt was necessary. Though it was a hard lesson to learn, I'm grateful that I avoided an unnecessary surgery on my arm. It's taken a long time to heal, but I think you'll get there in the end, especially if I listen to my body and members of my care team who've earned my trust. Even though I don't feel like anyone was gaslighting me about my arm, except maybe for myself, doctors and radiologists are human. An MRI was misread, but the lessons I learned from past gaslighting helped me avoid future problems. I wanted to share these stories in case you're going through something similar. Sometimes we doubt ourselves, and that can have real consequences. Medical gaslighting is important to be aware of, so you can recognize it and not fall for it. I'm not talking about doctors telling you things you don't want to hear, honest mistakes, or simple differences of opinion, but rather whenever anyone tries to convince you that what you're experiencing isn't actually real. Though I will add the caveat that if you have a mental illness that blurs the lines of reality, that's a different ballgame, and you definitely need someone more qualified than me to work through it. I'm not a professional. This video isn't medical advice, but these days my personal policy is that if something a doctor tells me just doesn't feel right or is risky, or if he makes me doubt my own experiences, then I get a couple more opinions and compare notes. The good news is that even though we can't erase past consequences, we can still learn from them and avoid similar pitfalls in the future. I'm Stephanina, and if you want to hear more of the backstory, here's a playlist. And whatever you're going through, hang in there. Believe in yourself and take things one day at a time. I'll see you in the next video.